All right, ladies and gentlemen, it is now time for the Men's Health Matters podcast. It's starting in 5, 4, 3, 2, 1.
All right. Did you all enjoy the women's podcast? Yes? Well, this one is for our men, right? We have the Black Men's Health Matters. Welcome back. I am your host, MarQuisia. This is the Fit and Fabulous Health and Wellness podcast, where we have questions that need answers. And so today I have 3 handsome men that I'm sharing the stage with. Don't get mad, ladies. Don't get mad. First, we have Dr. Kevin Lambert. He is a psychologist. Dr. Ronald Lester, he is a primary care physician, as well as Dr. Jeremy Brown, another primary care physician. Welcome, gentlemen. Welcome. Now, I have some questions that are specifically designed for your entity, and then we will take questions from the audience. Is that okay? All right. I'm going to start with you, Dr. Brown. How can we engage young Black men in discussions and activities that promote a healthy lifestyle from an early age?
Hello? Okay, that's a fantastic question, MarQuisia. So, in my opinion, this all starts at the home, so we need to remember that. Whoever you're around, whether you, let's say you don't have children, you might have a nephew, you might have some male influence over a younger individual that looks up to you. That's a responsibility that we have to really try to help get them on the right track. So, I know, for instance, I have some children, I have some nephews. They look at me for guidance. A lot of times it's, what's Uncle Jeremy doing, or what's Dad doing? So it comes down to, I really try to be cautious of what I eat, my exercise routine, just overall, I want them to see me really taking care of my health, so then they build those same habits to hopefully help them as they get older as well. For instance, I love to run. I run every Sunday, and my son started to see that. So when I'd go on my run, I'd come back. He eventually started saying, "You know what, Dad? I want to come with you. Can I start coming with you?" So I'll do my run, and then I pick him up, and we'll go run too. And I'm working on technique, and we just have a great time doing it. So now he's taking that as he's moving forward through middle school and implementing that in some activities that he does at school with sports. With my daughter, the same thing. And my wife and I, we really try to eat a well-balanced diet. So they see what we eat, and we try to implement the same type of diet for them as well. So they see that Mom and Dad eat a little bit of everything, and it's okay to not like something, but you should at least try it, And the last thing I'll say about this at this time is, a big thing is making sure your children or these young individuals that you have an influence on, that they really understand the importance of health. As a physician, they see what Dad does. He gets up and goes to work and helps other people. But I go to the doctor also. They know that Dad's going to go to his checkups. Mom goes to her checkups too. So when they see that when they're young, they understand that there's importance on making their health a priority. So if they can make their health a priority, that helps them in so many other aspects of their life too. So those are a few things that I would recommend.
Thank you. Give it up for Dr. Brown. All right. Dr. Lambert, can you address the impact of violence and trauma on Black men's mental and physical health and some strategies for healing?
Yes, that's a great question. It's a heavy question to start out with. Yeah. So, what I would say about that is that when we experience things psychologically, we also experience them they tend to manifest in our physical. So if I experience violence in our home, it may cause me to have an anxiety response when there's not even something that serious kind of going on. I anticipate chaos. I anticipate to be in danger, even when I'm in a space of safety. And so, that's kind of like, PTSD, but sometimes it's not as severe or diagnosable as PTSD. It may be just that I'm kind of guarded and just generally anxious because of the experiences that I've had. And people might say that that's, you're paranoid, or you're worrying about stuff that you're not having to worry about because of the environment or what have you. But if that's my experience, it's very real to me. And I may go about life just trying to protect myself and guard myself from those experiences happening again. And so it makes a lot of sense. One of the things that we need to make sure that you have clinicians that understand that cultural experience, have compassion for that experience, make sure that you are connected in your community where people can kind of normalize that anxiety and not make you feel like you're crazy for being concerned about these things. We hear a lot of, women of color concerned about their sons in terms of their safety, being pulled over, different things like that that are greater concerns for our community and the anxieties that exist around that. So I would say just making sure that you're noticing that sometimes you might be feeling it more in your body than you are in your mind, because you may not have that level of awareness that these traumas and these experiences have impacted you that deep. There's also some social pressure to be like, nah, I'm all right. I'm just going to dust it off, walk it off, and I'm going to be okay. And I think that pretty much since COVID, the media has done a really great job of really trying to promote it being okay to not be okay, and for people to seek help and support. And so just encouraging, men like yourself to be able to say, hey, are you all right? And I'm noticing this, I'm noticing that. Maybe we need to sit down and talk about these things so that hopefully you're coping well. Yeah.
Thank you. All right. Great answer. Dr. Lester, now you've been a guest on my podcast before. Welcome back. What obstacles do Black men face in accessing health care, and how can we address these disparities?
Very good question. There are several things that I would say are issues with accessing care. First of all, availability of people who look like you is a very common thing. Not a lot of access to African American primary care physicians who actually African American men feel comfortable with. And so oftentimes we'll push away from the actual field of medicine because we're not comfortable with the people who are sitting away, and we wait until preventive care becomes acute care, and then we seek out care from the emergency rooms. So I would encourage you to, one, seek that health care early as a preventive measure as opposed to waiting till the problems become more acute. Secondly, it starts at the root of the problem of availability. To physicians such as us starts with encouraging our children to enter these fields of care. You might find a lot of physicians who practice cardiology. You might find a lot of physicians who practice multiple specialties in medicine, but there are not a lot who are actually practicing primary care now in the African American community. And those are the gatekeepers to healthcare, and those are the first line of care that people honestly build a relationship with. And if you can't identify with African American, with your physician, oftentimes that builds a barrier of trust, a barrier between the trust and that patient-physician relationship. So access to physicians and access to people who look like you and building that physician relationship with our patients is very important.
All right. Thank you so much. Can we give our doctors a hand here for their answering of the questions? Now, audience members, it's your turn to answer any question that you may have as it pertains to men's health. So are there any questions in the audience? Yes.
Hello. As a black male, what preventative services should I be seeking for age 40 or above?
Age 40 and above, very good question. So age 40 and above has a specific, it is age related. Once you start to get over the age of 40, that's when we start looking at things such as prostate, particularly at around 40 to 45 is where I recommend your first prostate exam should be done. And a prostate exam, by the way, is not a digital rectal exam. It's blood work these days. So we don't necessarily have to do that exam that runs everybody out of the office. So that's the big thing for black men as well. They don't want to get that personal with their physician. So the good news is we don't do that anymore. I tell people before, if you're getting a digital rectal exam these days for a prostate exam, that's called assault. So we don't do that anymore. Okay, so the good news, that's what I thought. A lot of y'all stay away.
Can you repeat that?
That is, a digital rectal exam is no longer the first line of treatment or evaluation for your prostate. It's called a PSA, a blood work test that tells us where you are in terms of the size and the growth of your prostate. So that can be done with all the rest of your labs. Okay. Between the ages of 45 to 50 also is when we start screening for colon cancer, okay? So usually that can be in a couple of forms. Everybody's heard of a Cologuard where you again at home give a stool sample and mail it in, and it tests specifically for genetic material associated with prostate cancer, okay? And so you can do a Cologuard or you can do a colonoscopy depending on your risk factors. They generally say 10 years prior to the onset of colon cancer in a family member. So if you had a family member who had colon cancer at the age of 50, then you want to start getting colon cancer screening at 40, and particularly a colonoscopy if you have that in your mother or father, okay? I wouldn't go with a Cologuard if you had colon cancer in your family. They need to see it. Quite frankly, you can get small precancerous polyps that slowly morph into true cancer over a period of 5 to 10 years. You want to get regular checkups to rule that out if you have colon cancer in your family. Screening I also recommend flu shots, and when you get over the age of 50, we talk about shingles vaccines, pneumonia vaccines as well. So all of those things.
I just want to add, I 100% follow what Dr. Lambert said there. Lester, I'm sorry, what Dr. Lester said. That's the first thing to kind of get a man to run out of the office is when you start talking about the digital rectal exam for prostate screening. And so many men, when you mention, well, we can monitor that with the blood test and we look at patterns over time, they're like, oh my gosh, okay, that's great. So there's a lot of preconceived notions and fears surrounding healthcare that really prevent a lot of patients from coming in to see us. So that's a great point that Dr. Lester has made.
I can give you an anecdotal story on how many times black men have come into my office looking at me like they're ready to fight. And when I shake their hand and say, let's go get blood work, they're like, wait a minute, we're finished? Because they're too used to getting a digital rectal exam, and somebody made them come, and they just were set on getting it done. And I was like, I'm not doing that. That's good. Neither one of us want that. So that's really important that you understand healthcare. We try to make it as easy as possible, but let's do the preventive care, because unfortunately the number 3 cause of cancer deaths in African Americans is prostate cancer, which is completely preventable. I mean, it's very much so a treatable cancer, but you got to be able to get screened for it, and you got to know it's there before it's too late, before you reach stage 3 and 4 in it. And so.
Right. That was a great answer. Yes.
Yes. I've had several people I know, they've died from the blood clots in their leg and aneurysms. Is there any preventative things to know if that's a factor with you?
Dr. Brown, we'll let you answer first.
If I may, I'll kind of give a own little testimony here. So first off, with the legs. So those clots, we call them DVTs, deep vein thromboses, okay? Usually, if that happens, you'll have swelling, all right? And usually it's unilateral, we say. Usually it's in one leg, all right? There's pain, sometimes there's redness, but sometimes the pain comes and goes, sometimes it's there, sometimes it's significant swelling, sometimes it's not significant swelling. But as the individual, if you have noticed that you have pain or swelling in one extremity, usually we see a lot in the calves. I've had patients who have even had them in their upper thighs as well. And if you've been kind of stagnant for a while, meaning, let's say you went on a trip, you're flying somewhere, you're in the car for a long period of time. Or if you're on hormone replacement, that's another one too, because that can actually increase your chance of getting blood clots also. If you experience something like that, you have a primary care doctor, go see them, all right? Or even go to the emergency room, because what we worry about is if those clots break off, they can go to your lungs and cause a pulmonary embolism, and then you may not survive that. So it's extremely important to listen to your body, and based off of part of why we're here, so many of us in our culture will say, it's okay, I'm fine, let me sleep it off, I'm gonna take some Tylenol. Sometimes that's right, but most of the time it's good to get that extra reassurance from a medical provider to make sure you're okay.
So I'll piggyback on what he said specifically about the swelling. Swelling in one leg, okay? One leg, if you get swelling in one leg more than the other, that needs the attention of a medical professional, okay? Because if you get swelling in both legs, it's a whole nother different issue. It could be a lot of different things. But swelling in one leg is most likely, it concerns us most oftentimes for clots, okay? And if that clot passes above the knee, it becomes more dangerous than if it's just in your calf, okay? So it's really important that you get that stuff looked after. You asked about aneurysms as well. Not really a whole lot of screening, preventive screening we do for those, but the things that people oftentimes mention is relapsing, remitting headaches, migraines, and things of that sort. Elevated blood pressure beyond your normal things, normal blood pressure. The worst headache of your life, for instance, would be those triggers that would tell us, hey, you need to be checked out.
If I kind of add on,
yes.
I want to add on too, from a personal experience. So I actually had brain surgery in December of 2022 because we found a brain aneurysm. So I wanted to make sure I shared that story with everyone too. So when my dad was 42, he had a brain aneurysm that ruptured. Had no idea. He was a smoker. He had some other life habits that maybe perpetuated this happening. Ruptured, survived it. Okay? Passed away from a heart attack, unfortunately, when he was 51. So I was 19 at that time. So that was another big reason I made sure my health was always so important. So fast forward, I go to the doctor all the time. I'm 41 now. I see my doctor when I'm 39, and we have a conversation about just general health screening. We scan my heart. It's a test called a CT calcium score test, and I can explain that later. But we were looking for potential plaque buildup in my coronary arteries. Thankfully, there was no plaque, but we found out that my aorta is wider than it should be. All right, so that calcium score helped pick that up. So it said my no blockage, but my aorta is a little wider than it should be. Well, because of my dad's history, so this is why knowing your family history is so important. My dad's brain aneurysm history prompted us to scan my brain, and we found out that I have a brain aneurysm. It was very small. It was 3 millimeters, but the doctor said, you know what? In a matter of 10 years, Jeremy, this would have ruptured. So me going to the doctor, talking to them about these things, really saved my life. So as Dr. Lester was saying, you're right, the things about the headaches and all that, definitely telltale signs, because my dad had the worst headache in his life. But for me, I didn't have the headache, but having preventive care in place helped me get to the doctor in enough time to fix it. So, yeah, I just want to share that with you guys.
I want to add to the mental health piece of, you said 40 plus, right? So a lot of times that's the stage of life where we're, trying to raise families, we're trying to build our careers. Usually we're kind of in the full swing of a lot of those things, and so a lot of times we don't attend to ourselves as well as we should. So, sleep tends to get put on the back burner. We work late, get up early, trying to, keep up with the kids and all of that sort of stuff. And so the way that plays out is that when you get to 50, 60 years old, that buildup of not getting the proper rest tends to impact your brain functioning, how well you remember things, how sharp your mind is impacted by an accumulation of not getting enough sleep. There's been studies even in regards to the development of dementia and Alzheimer's as a result of just a chronic history of a lack of sleep, lack of rest. So, yeah.
Thank you.
So I have two questions. First, to piggyback on the young man on the end, for questions, what should people or men over 60 be doing besides the things that you've already mentioned from a health screening perspective? And I have a 23 and 24-year-old that moved back home after graduating from college that are looking for an African-American physician. Is there a directory or a place that we can go so that they can go to physicians that look like them? They had that as as young kids, and so they want to continue that, but we have not been successful to find a general practitioner.
There's a Facebook directory where it's for DFW Black clinicians or Black medical healthcare professionals.
And there's also the C.V. Roman Society. I'll name the C.V. Roman Society. That's the National Medical Association for the Dallas-Fort Worth area. It's called the C.V. Roman Society. It's named after a very prominent African-American physician in the area. And so that is, in essence, our big organization in this area. We've had several meetings, and we meet every at least once a month, but at the end of the year, we have a large gala. And you'd be surprised that room was full of African-American physicians. And so if you look up their website, they oftentimes will have a link there where you can find primary care physicians that look like you. And, as it relates to your question about after 60, most of those things are the same. But I always also add, for those people at the age of 40, I always screen all of my patients for diabetes. I screen all my patients cholesterol. And I mean, that's whether you're 20 or otherwise. And I also, when you get over the age of 40, also the other interesting thing, particularly as it relates to men that we don't talk about, 40% of men have issues with erectile dysfunction. 40% of men over the age of 40, and we don't like to talk about it. And we definitely don't like to talk about it when it's somebody who doesn't look like us. But then they send their wife out the room and say, "Doctor, I need something." And I already know what the conversation is. And so I check testosterone levels and things of that sort as well whenever I have those issues that come up. We deal a lot with obesity. We deal a lot with all of those things that are underlying issues. He mentioned the calcium score. I like to get calcium scores on men over the age of 50 because it tells us how much atherosclerosis and calcified chronic atherosclerosis you have in your heart. Scores up from 0 to all the way up to over 1,000. And anything over 400 means that you need to go see a cardiologist for further risk stratification. And so I've had 2 calcium scores. My first one was 0. My second one was 1, which means I'm in a good place, right? But if you get over 100, then it puts you at mild risk of heart attack. 200, moderate risk. Over 400, you're at high risk for having a heart attack. And it's just a CT scan that takes you less than 15 minutes, okay? So, and then the other barrier to healthcare is cost. A lot of people don't have health insurance, a lot of things, so we have to accept that there's a cost for healthy living. Sometimes that calcium score might not be covered. It's a $99 test. Go get it, okay? It's $90. Get that test if you're over the age of 50, just to see where you are. It might save your life, okay?
So once again, that was a Facebook, but your son is in his 20s. So he's more apt to go to Facebook than the CV Roman. So for your son, it's a Facebook page. Say the name of the page again.
It's DFW Black Healthcare Providers.
DFW
Black Healthcare Providers.
And for yourself, the CV Romans.
CV Roman Society.
That's very
You can
good.
probably find both of them. I'm sure they have a Facebook page and they have an Instagram page, and they all can. Yep, they're everywhere. So.
Very good. Are there any more questions? Yes.
I have one more question. Can you talk a little bit about sleep apnea and some of the impacts that health-wise that has? Because, you know, a lot of times you may think snoring
It's
is
just
normal.
bad snoring. And so, no, it is not just bad snoring. Sleep apnea can be a cause of severe illness, pulmonary hypertension, right-sided heart failure, and when you get that far, it's called a Pickwickian syndrome, and the only cure for that is a heart-lung transplant. So letting sleep apnea go untreated can kill you. Okay, so.
And on a personal note, I'm taking a sleep study right now so that I can get diagnosed. I know I'm not a man, but we're talking about health. And so I'm taking a sleep study at this moment so that I can get myself treated if I do have a diagnosis with my heart, with sleep apnea, so on and so forth.
Correct. So the biggest thing that I tell people is like it's like everything with preventive care. Most of the things that get us don't get us immediately. Hypertension, diabetes, sleep apnea. It's the long-term effects that we're trying to guard against, and particularly when it comes to sleep apnea, it's snoring with pauses, with large pauses that your spouse said, "Man, I thought you stopped breathing," and she shook you or something because you stopped breathing. Get a sleep study. And some people can't tolerate the mask. There's Inspire now, which also stimulates. There's a device that you can have implanted that is basically like a TENS unit that stimulates the root of the tongue and causes it to thrust forward to open up your airway. It's called Inspire. So if you can't tolerate that, you can tolerate the Inspire. You got to do something because it is not a benign condition. Should be treated.
Now, I do have a question for Dr. Lambert. If you don't mind, can you address the role that the media plays in shaping the perceptions of Black masculinity?
Say the last part.
Address the role that the media plays, social media, the print media, the news, everything like that they play in shaping perceptions of Black masculinity and its impact on mental health.
The way in which we're portrayed is the way in which we tend to be perceived, right? And then we internalize a lot of those messages. So, some may say art imitates life, but sometimes there's an agenda behind what's being, portrayed on the screen, and they're trying to kind of shape your view, if you will. And so I think that right now, one of the ways in which I see that played out, and actually it's been this way for quite some time, just men in general, how they're portrayed in TV shows in regards to being capable, competent leaders of their families, knowledgeable, responsible. A lot of characters tend to be kind of goofballs, if you will, and sometimes we also see, Black men, the expectation that you either are more of a thug and ruthless, or you're just very passive, if you will. And I think that being able to model, especially to young men who are still trying to discover their identity and discover their place in the community, it's really important for us to kind of combat that with trying to put positive images out there and trying to give feedback, kind of support shows or support those images, or whether it be a social media post. If we don't like them, then they kind of tend to go away. But when they get a lot of attention, then they get played up. And so just being mindful of those type of things, of what we give how do we celebrate the models that we would like to see in our community? So yeah.
All right, thank you. We have time for one last question. Is there any other question in the audience? Yes.
So my father is, he has 4 daughters. I'm the oldest of 4, and so, it's a transition when you have an adult parent and you're an adult child, and that switch over where that transition is where you're feeling like you're being the parent to your children. So in all aspects of just like preserving their life, but having that talk with them that might be a little bit challenging, especially with 4 daughters and a mom like is outnumbered. my dad's outnumbered. But how he's African American also. But I guess my question is, how is the best discussion with a man that he's Nigerian as well, I should add. So there's a lot of like fussiness that happens. So I'm just trying to see a good conversation to lead into just some things that can help him. Like, I know it's an encompassing question, so I'll leave it at that.
Okay, Dr. Brown, we'll let you answer first, and then Dr. Lester.
I think it's very important to create a safe environment. So my first question would be, with your father, do you have the same primary care physician, or does he have trust in his primary care physician? Okay. So it might be a matter of you setting up an appointment for this in particular and go together and try to maybe talk through some of that together and see if there's a common ground to try to hopefully obtain. And so I usually start there, and then honestly, when we get to that point, because there's multiple levels to it, that's when I get in contact with my friend here, Dr. Lambert, to help that. So that's how I handle those types of conversations.
Yeah, I'll piggyback on that real quick. That, sometimes we need to figure out ways to make it where getting support is not because you're crazy, because even necessarily that there's something wrong with you. As a matter of fact, some of the healthiest people I know are the ones that are seeking help consistently, right? As Dr. Brown was just saying, like going to the doc, I know I'm well because I actually have verified that, versus I know I'm well because I have convinced myself, or I'm trying to make myself well because of what I'm worried about what other people will think, or what this might mean, because I don't want to hear bad news from my doc. To go and find out and to make sure that you're well. And so I would encourage you to, again, make it safe, as Dr. Brown was saying, in terms of, it being okay that there might be something going on here. And the best way to address it is to verify that you're okay. And I would say also, in connection to just relationship-wise, because those of us that are 40 plus, we're also getting to the age where our kids might be graduating from high school. We're starting to get closer to that period of like empty nesting and all of that sort of thing, which is kind of a red zone for our marriages and our relationships, where, we've had 18, 20 years of raising these kids, and then now they're leaving, and it's like, who are you? Yeah. Yeah, and so being able to make sure that you're attending to that, not necessarily going to see a therapist for marriage counseling, although getting in front of it is really wise. But just being more mindful of it, of like, what are the things that we're doing to kind of create some insulation around our family and around our relationship. So we go to, make sure we take a vacation, or we, have a date night, or we do some family, things to sort of make sure that we're spending time together. Even something as simple as making sure we have family dinner at least once a week, because I know a lot of times our busy schedules, we don't even sit down at the table together and have those old school conversations. I remember when I was growing up, when my family, on Sunday after church, we would have these big brunches, and that's when all of the stuff would come out and all of the conversations. And so just creating some rhythm where, you know, at least once a week, we all sit down together, share a meal, you know, and talk about what's going on with each other and try to provide some encouragement and safety, you know.
Dr. Lester, we'll let you have the last word.
I think one of the things that we should do is have those conversations as early as possible. And in fact, include in those conversations, frank conversations about end of life, advanced directives, and everything in those conversations. You need to know what your loved one's wishes are as it relates to, hey, if I get sick, for instance, I tell my people, if I get really deathly ill, you got a month. You got 1 month. You're going to hook me to a ventilator. If I don't get better in a month, disconnect me. I want to be cremated. All right, don't waste your money on have a party, don't have a funeral, those type of things. Your family needs to know those things, okay? So that it lifts the burden off of, I mean, men, we sit around, we don't talk about it, and then we leave that responsibility with those who are left behind. You should have those conversations early on before it becomes a problem, and now you're stuck there arguing with your loved ones, and it produces a rift within your family. The last thing I say is men have to be brave enough to talk to other men about problems that they're having, because we isolate ourselves and we withdraw into our corner, and then that's where the enemy wins. So particularly as it relates to mental health, you are not alone. There's a large swath of suicides going on, men of our age groups, because they feel like they're isolated and no longer relevant. You got to know that you're not by yourself with that, so talk to someone, him, friends, and be open and honest about it. Stop being so hard.
Well, we want to thank all of our doctors for coming out and answering the questions that we needed to have answered. Can we give these men a round of applause? Dr. Jeremy Brown, Dr. Kevin Lambert, and Dr. Ronald Lester. We do have some gifts for you guys from the Fit and Fabulous Health and Wellness Podcast that we want to present to you all. This has been the live broadcast of the Fit and Fabulous Health and Wellness Podcast. I'm MarQuisia. Have a good day.
You go bow for the result, oh. Nothing to discuss, oh. Cause I did win by default and without any doubt, oh. I'm a me happy adult, oh.